Hi, my name is Dr. Kent Stuber. I'm an assistant professor and clinician scientist in the Parker University Research Center. The title of the study that I'm going to present today is Attitudes Towards Patient-Centeredness Among Canadian Chiropractors. I'd like to thank my co-authors, Dr. Silvano Mior, Gina Dolan, Mark Langweiler, and Peter McCarthy. I'd also like to take this opportunity to acknowledge the traditional territories of the people of the Treaty 7 region in southern Alberta. The city of Calgary, where I live, is also home to the Métis Nation of Alberta, Region 3. I'd also like to thank the University of South Wales and Canadian Memorial Chiropractic College that helped administer this study, and the Chiropractic Research Council of the United Kingdom that provided study funding. Just as a bit of background, patient-centered care has been found by numerous policymakers and researchers to be an important component of healthcare in the 21st century. Among the reasons for that is that patient-centered care interventions can lead to improved outcomes for patients. And previous research has also shown that patients with more patient-centered physicians tend to have higher satisfaction rates. The purpose of this study was to assess the orientation towards patient-centered care among chiropractors participating in a practice-based study. For methods, we used a convenient sample of chiropractors, and it was a sequential explanatory mixed methods design. So in this type of design, we first collect quantitative data, and then we collect qualitative data, and then use that qualitative data to help explain what's going on in the quantitative data. So in this case, our quantitative data consisted of a questionnaire that the chiropractors completed. We analyzed that, and then we used some of those results to help inform the questions that we were going to ask in the interviews with the chiropractors later on. That helps connect the data between the two. In the qualitative data collection, we did individual semi-structured interviews. We ended up doing 7 of them before we reached saturation. And then we analyzed the data using thematic analysis. And then you bring the data from both data sets together again. And as I said, you try to use the qualitative data to help explain what's going on in the quantitative data. So in our questionnaire, we asked the chiropractors several questions, some demographic questions, some about their practices, some about their practice patterns. And we also asked them to complete the Patient Practitioner Orientation Scale, or PPOS. So the PPOS is an 18-item questionnaire. It has 3 of those items that are reverse scored, and each of the items is scored on a 1 to 6 scale. So typically the scores indicate that a higher score indicating a more patient-centered attitude. And the PPOS generates 3 different scores. There's an overall score, a sharing score, and a subscale score. Krupat and colleagues determined that a score between 5 and 6 on any of those scales tends to indicate more patient-centered attitudes. Krupat and colleagues also defined the sharing subscale as the extent to which the respondent believes that patients desire information. It should be part of the decision-making process. And they defined the caring subscale as the extent to which the respondent sees the patient's expectations, feelings, and life circumstances as critical elements in the treatment process. So looking at our results, we included 31 chiropractors. 10 of them were female, 21 were male. On average, they've been in practice for about 15 years. Most were trained in Canada, and most were involved in multidisciplinary practices. On average, they spent about 32 hours per week seeing patients, about 90 patients per week on average, and so that worked out to roughly 3 patients per hour. Looking at the PPOS scores, again, a reminder that higher average scores indicate more patient-centered attitudes, and Krupat and colleagues had decided that patients, for a result to be considered patient-centered, had to be between 5 and 6 on average. The average PPOS overall score was 4.35, and that was significantly associated with the number of patients seen per week if it was over 100 or more, and also significantly correlated with the number of years in practice. When we asked chiropractors about this, we were actually a little confused as to why the increasing number of patients per week would be associated with more patient-centered attitudes. Again, the chiropractors didn't actually have an explanation for that either. They felt that the more patients you see, the less attentive you might be to patient needs. For the sharing subscale scores, they were lower than the overall scores at 4.2 on average, and that was significantly correlated with the number of patients seen per week, number of patients seen per hour, and the number of years in practice. Trying to determine why those scores might be a little lower, when when we asked chiropractors about how they develop treatment plans, they indicated that they tended to focus a little more on the evidence and their past experience, and didn't tend to give patient preference or patient input as much thought. So not necessarily taking all three components of the evidence-based practice model into account. The carried subscale scores were the highest of the three at 4.5 on average, and they were significantly associated with the number of years in practice. One of the chiropractors gave a nice explanation as to how they really try to think about the patient and develop a good relationship with them and really learn more about them, and that might explain attitudes like that might explain why the carrying subscale scores were a little higher. So our study, to our knowledge, was the first that's assessed the orientation of care among practicing chiropractors using the PPOS. Hamrick and colleagues previously conducted a survey of chiropractic students where they had almost 2,000 students from 7 different institutions complete the PPOS. And their average scores were 4.18 on the overall, around 3.9 for the sharing, and 4.5 for the carrying. So lower than what we saw in our study for the overall and sharing scores, and about equal for the carrying subscale scores. Our PPOS scores indicate more doctor-centered orientation among those surveyed, but that's comparable to what we've seen in the literature in other health professions. A little higher than some studies of medical doctors, 3 of them, and a little lower than some of the other scores that we've seen with medical doctors. Majorano and colleagues in 2022 published a meta-analysis that looked at 20 studies of healthcare students, a little over 8,000 students included in their meta-analysis, and the average overall score of PPOS for those studies was 4.16. The chiropractor sample in our study was comparable to what we've seen in recent surveys of Canadian chiropractors in terms of male to female ratio, number of years of practice, country of training, patients seen per week, and the number of hours per week. So we feel that our sample was actually fairly representative. And as we saw, the number of years in practice and the number of patients seen per week was significantly associated with higher PPOS scores. And we think what might be going on there is that more patient-centered attitudes may be learned through greater clinical experience with patients. In terms of our limitations, first was our sample size with only 31 people that included in the analysis. We're also uncertain of our response rate, and this was a convenience sample. In the interviews, we actually found that our sample was a little overrepresented in terms of the number of males, those who were more experienced and those who were Canadian trained. And it's also possible that there were some learning effects from having completed the questionnaire. And it's also possible that my presence as a chiropractor may have led to some investigator effects during the interviews. Finally, we didn't employ any member checking. Well, that's it for my presentation. I'd like to thank for your time and attention.